Good morning, everyone. More Good Days acknowledges the traditional custodians of country across Australia and their deep ongoing connection to land, water, culture and community. We pay our respects to elders past and present and to all Aboriginal and Torres Strait Islander peoples today. Welcome to this session. Very excited to be sharing these MoreGoodChats with you live with Dr. Yonit Arthur. We're looking today at chronic dizziness and the brain-based approaches to help calm the nervous system and find balance again. So before we dive in, just a quick recap for those of you that are joining us maybe for the first time. Just like to remind everyone we're recording this session. So by being here, you're kind of indicating that you know our terms of the invitation and our guidelines here. So yeah, no hate speech is tolerated. Please be respectful of the speakers. Keep your microphone muted if you can. And like I said before, putting questions in the chat is totally fine. We'll try to address those as best we can if there's time at the end. So yeah, without further ado, it's my pleasure to introduce you all to Dr. Yonit Arthur. Dr. Yo is a board-certified audiologist, a vestibular specialist and coach, and she specialises in helping people with chronic dizziness and other vestibular symptoms. Dr. Yo is certified in advanced vestibular rehab and concussion treatment through the American Institute of Balance, and she's also certified strength coach. She's been trained in multiple treatments for neuroplastic and functional neurological disorders, undergone extensive training in counselling, including cognitive behavioural therapy and experiential modalities like internal family systems and coherence therapy. Dr. Yo is committed to helping as many people as possible for free and has hundreds of educational videos on her YouTube channel, The Steady Coach, which we'll put as a link in this reference as well. And on there, there's just this comprehensive guide and resources. So in the session, we're going to touch on why chronic dizziness persists when there's nothing structurally wrong and how the brain's protective responses keep these systems going and stuck, how a mind-body or brain-based approach can help in reducing fear around symptoms and calm the nervous system, and some practical ways people can retrain body and brain. So yeah, before we even get going, I really also want to say that dizziness and pain are very real experiences. They're not imagined, they're not all in your head. In chronic conditions, we do know that symptoms become less about ongoing structural damage and more about the nervous system, and sometimes it being overprotective and sort of staying in this over alert state, and it can misinterpret signals from the body. So yeah, Dr. Yo, it's the first time we've had an audiologist, and so I might just kind of throw over to you in terms of telling us a little bit about you and your journey and how you came to this kind of place of being interested in supporting people with chronic dizziness.
Thank you. And thank you for the beautiful introduction and for having me. This is obviously something I'm extremely passionate about. And so it's an honor to be here. And also, even for people who don't have chronic dizziness as a primary symptom, I think they'll still find a lot of what I'm talking about today very much relevant to their recoveries from their symptoms. So audiologists don't usually do what I do. let's maybe start there. And I found that very frustrating because most audiologists, as part of a medical system, our job is to diagnose problems. And that's wonderful. It's good to diagnose problems, but I found it to be rather, not very fulfilling to slap diagnostic labels on people's foreheads, particularly given the types of diagnoses I was giving people, and then just say goodbye to them and not be able to really help them. So the long story short is I burned out doing that. I quit. I decided to never touch audiology again, and then got roped back into it through a series of unusual circumstances and realized I could help people. I just needed to do it outside of the medical system. And that's when I was working as a coach for people here locally. I started the YouTube channel, and it turned out it's a much bigger problem than I ever knew. And people all over the world were having this problem and weren't being given the information that I had. So I said, well, I'm just going to have to share it all. So that's what I've been doing for the last 6 years.
Yeah, and yes, the world is very grateful for the number of people that you've helped and supported along that journey, because when it comes to something like chronic dizziness, it's a symptom that's, can be really disabling, especially for people that maybe have not experienced it before, whether it's new or whether they've, tried different scans and tests and been told, there's nothing here. I can imagine that's super confusing and frustrating and unsettling. So let's which is why I'm sure it's so rewarding for you to be able to actually give them some hope, some explanation, which can be so validating just to get that. I know from my experience, although it's not the same symptom, but just to sort of get someone say, I see you, I hear what you're going through, and this could be what's happening. And it's really quite relieving to know that there's a reason behind it all. And so, let's talk a bit more about dizziness as a symptom. What are some of the definitions or things that you might give in terms of why people might experience it and why, or it might hang around is another thing that people find really frustrating.
And that second part is really the major question. So would it make sense to start by just describing what dizziness is, so we're all on the same page? Yeah. Okay. So dizziness is a very general, sort of vague description of any type of symptom that is you describing your sense of orientation being off. And that can mean dizziness, like I feel off, but it also often affects the eyes. So people will often notice difficulty focusing their eyes or following moving objects or turning their head quickly without feeling really off. They may feel pulled to the side. They may feel rocking, bobbing, swaying at all times, or when moving. They might find that symptoms go away when they're moving or not, or get worse when they're moving. All of these, again, that's the briefest possible list. I could spend the next hour listing all the symptoms that I see, but all of those, that what they have in common is there's some issue with how the brain is perceiving orientation. And orientation is something that your brain builds from three senses. So your eyes, ears, and sense of touch all contribute to your sense of orientation. So that's why we could have so many symptoms. They can be symptoms that affect any one of those three senses. So sort of getting to your original question, what makes dizziness happen and what causes it to stick around? Those are two very, very different things. And I think that's the most important thing for people listening to understand. There are many things that cause dizziness. If any of you have ever taken a medication, gone on a roller coaster, gone in a car, I mean, literally anything you do, there's always a warning. It could cause dizziness, because dizziness is a universal experience. It's the kind of orientation is something that requires a lot of coordination, as I said, between three sensory systems. So if you disrupt one, it can cause dizziness. So dizziness is very common. What makes it stick around is something totally different. So what makes it stick around, I think this will be very familiar to people listening, is it's one of two things. It's either there's some kind of structural problem that's preventing the brain from getting the information it needs to orient you. That's option one. Option two, your brain's getting everything that it needs to orient you, but it's not putting that information together correctly. And that's where chronic symptoms often happen. They're almost always in that second category. Usually, if there is a structural problem, it either goes away or the brain can, what we call, compensate for it, meaning the brain can figure it out and kind of rebalance using the information that it does have. But most of the time when we have chronic symptoms, it's a brain not using sense information correctly problem. It's not a structural problem. It's a brain understanding problem or a brain opinion problem.
Mm-hmm. Yeah, and I can imagine even just hearing you sort of describe what it feels like, and I have experienced it, in various different, stages. Even as I've just thought it just then that, as a side effect from medication, dizziness was a really big thing that I had many years ago. Like I like your description of it. Makes you feel off, like it just makes you feel like something's not right, which is where you can understand, that people would find those symptoms very scary, particularly when it's something like, I'm not sure where I am in space, and the fear of falling or whatever kind of impact that might have. Many people probably come to our program experiencing a symptom like dizziness, and it might have happened after or in conjunction with some of the other reasons they come to us. So they might have experienced a whiplash or a concussion, or they might be experiencing neck pain or migraine. So, can these conditions trigger dizziness? Is it that they Is there overlap?
Can they? Can they? Why wouldn't they? Again, sense of orientation it takes a whole lot of brain coordination, and it's a very tricky dance that the brain has to perform in order to orient you. We take it completely for granted because it works most of the time. But yes, in fact, I would say the majority of the people I see, their symptoms started with something. They didn't just pop out of nowhere. If they popped out of nowhere for you, you're still in the right place, believe me. But for many people, they start with a concussion. They start with whiplash. They start with a brain injury. They start with a growth or an illness, often post-viral. They'll start post-viral. They can start from pretty much any insult to the body or brain, even if those things are temporary, which in most cases they are. And because dizziness, you alluded to something earlier that I think we're going to be talking about a lot today. Dizziness is scary. And it's not just scary in the, wow, I really don't like that, that's awful way. It's scary in the visceral way, in the survival way, because your sense of orientation, I would argue, this is my biased perspective, I would argue is the most important sense we have. If you're not oriented, then what's the use of any of your other senses? So it triggers a very deep sense of danger. It triggers fight or flight automatically. And so most people who experience dizziness also experience a high amount of fear and anxiety. And that plays into what we're probably going to talk about later, about how we address it.
I'll address it, yeah. And I think that's also just, helpful to hear for people that have experienced this symptom, that like, it's just understandable that you would have this, fear and anxiety around this particular symptom.
Yes.
Yeah, and I suppose you have touched on this, but maybe if you can just expand on it a little bit more. Like we know from the chronic pain space that the brain is just so powerful in its predictive ability, and its like learning of patterns and things like that, and its ability to try and protect us. It's always trying to do that. And so in the chronic pain space, we're often talking about how the brain is likely to continue producing symptoms, even when there's no ongoing tissue damage. And it sounds like chronic dizziness, there's that overlap as well. So maybe if you could just sort of, even if it's to reiterate the point a couple of times, talk about the evidence about this brain-based kind of understanding of perception when it comes to dizziness.
I am so glad you're asking this now and not 6 months ago, because we finally have white papers describing this. So we've had, yes. So we've had research. Researchers have been on this for a while in the general like sensory perception realm, but we finally have papers now that are specifically talking about chronic dizziness being an altered brain prediction problem. So we actually have it in black and white now in some very prominent journals. So I'm just sorry, I'm nerdy, and that excites me a lot. And so I'm going to share
totally,
that with all
and
of you.
we're all for that, and we can link to those too in the references.
Yes, yes. Some of you may be nerds like me and will really enjoy these papers. So yeah, so like with every other sensory system, our brains don't just respond to orientation information. They predict if you're going to be oriented or not. And meaning your brain has the job of predicting both. Well, not both. It has the job of predicting what all three senses are going to say: the eyes, ears, and sense of touch, and then what that means in context and what that means about your sense of balance and orientation. So that what ends up happening there is, normally the brain will take new information in from the senses, and it will say, okay, what I'm expecting is this, but the sense information says this. And then it just updates. It says, oh, my expectations were a little bit off. So maybe you feel a little bit dizzy, but then it quickly corrects. And then you're not dizzy anymore because your brain is expecting what you're getting. When your brain's expectations match reality, you feel great. When your brain's expectations don't match reality, you might feel a little bit off, but most of the time that's self-correcting. Your brain just figures it out. Enter danger signals. So when your brain is perceiving danger, the way I think of it, maybe other people haven't heard it described quite this way, but I think of it as the brain going on sort of lockdown mode. So it has these expectations.
We know all about lockdown after COVID.
Right. Right. I know. Gosh. And everyone, unfortunately, we
Yep.
all sort of have some stress about that.
Yeah.
But your brain sort of goes on lockdown mode. And so what that means is that it has these expectations. Okay, this is what I'm expecting to get in this environment from these three senses. And the sense information says, no, that's not what's happening. And your brain's like, what? I don't believe you. Wait, what? And it's kind of trying to argue with the sensory systems. I know I'm being ridiculous here, but my point is the brain's not updating its expectations, which means you stay dizzy because the expectations your brain has are not matching sensory reality. There's a mismatch between them. And that means you're dizzy because your brain's like, I don't, this information coming in doesn't make sense. Here are my expectations. This doesn't make sense. When the brain can't make sense of the information coming in, you're dizzy. So unfortunately, as we've already talked about, once that starts happening, then you feel scared. And then when you feel scared, that further increases how much danger your brain's perceiving. And then what does it do with the expectations? It locks them down further. And then you start to avoid things. And then your brain develops a whole new set of even more rigid expectations that new sense information just don't penetrate anymore. And that's why people without the proper education will end up with chronic symptoms that even worsen over time rather than getting better, even if they're trying to live their lives.
Yeah, and it kind of, it all makes sense, doesn't it? That if the brain is perceiving danger, that we then maybe avoid something, but it sounds like that then doesn't give it the ability to experience it and to update that sort of, misalignment between what it's predicting and what it actually is experiencing in the moment.
Exactly.
And yeah, I think you've touched on this, but again, just to sort of double click on it, that it's the context that matters, isn't it? That if the brain's already a bit like, what's going on, not sure about this, or there's a danger, or there's other things going on in life, other stresses, other pains and symptoms, then when the brain's on that high alert mode, it will go to, this is going to be bad, expect it to be bad, and then just override perhaps information that might be coming from the body.
Exactly right. And I love that you mentioned that context. I talk about that all the time. I call it the stress bucket. Anyone who knows my work, they're probably so sick of me hearing me talking about it because I talk about it constantly. But yes, context matters. Most people who get dizzy don't stay dizzy. So I'm always thinking, okay, so what makes someone stay dizzy? And context is a big part of that. Yes.
Sorry, glad you also mentioned that. I was muting myself as my dog's dreaming and making lots of noise in the background here.
Predicting danger.
That's right. That's right. And we will get to unpacking some of these changes and that processing and how important the stress systems are and how we can maybe approach those in our recovery. But I think something maybe for any clinicians listening, given your experience as an audiologist, what maybe are some of the common misinterpretations around the causes of dizziness that might be out there and potentially perpetuating some of the problems we're seeing with people?
I love that you just gave me the opportunity for this soapbox. I'm very excited about this.
It's all yours.
Yeah. So clinicians are trained to find a pathology. So they're going to look for a pathology. And sometimes there is one there that set the symptoms off. The common ones are BPPV, or benign paroxysmal positional vertigo. Fancy word. It's the crystals in the ear problem, if anyone's heard of the crystals. It basically, it's a physical cause of dizziness that's reversible with simple exercises. It's not a permanent cause of dizziness. Another one is vestibular neuritis, which is an inflammation of the hearing organ and or the hearing and balance nerve. So vestibular neuritis also causes dizziness when it's there. So often things will be blamed on that. Those are the main two, like purely structural problems that things are blamed on. But people are also often, this gets a little thorny, blaming chronic dizziness on migraine and on other structural ear problems that do exist, like Meniere's disease, but they're sort of lumping anyone who has dizziness symptoms into one of these medical categories when many of the people who have these symptoms don't meet the criteria for these being the problem. So with BPPV, it's temporary. With vestibular neuritis, it's temporary and your brain compensates for the problem. Most people who have neuritis, even if they have actually it can totally destroy, unfortunately, the nerve in the inner ear, but the brain can compensate for that. I've met people who have no function on one side and are not dizzy. So the brain can compensate even for the loss of one side, but people are blaming chronic dizziness on vestibular neuritis, which is not accurate. Meniere's disease, it's overdiagnosed. People are coming in with chronic dizziness. The doctor says, oh, you must have Meniere's disease, which again is a real problem, but it's not the problem in most cases when someone has chronic everyday symptoms. And migraine, a little trickier because migraine also has neuroplastic, a strong neuroplastic foundation. But again, what I'm seeing is people who have symptoms all day, every day being told, oh, you're just having constant migraines and that's what's leading to symptoms without really any evidence that that's what's happening. Let's just leave it at that for now. So what all of these things have in common though is we're trying to find a pathology that we can treat with a pill or a procedure or vestibular rehab, and we're ignoring the things that actually make symptoms chronic. None of these things that I just mentioned should cause someone to have symptoms every day for years. That doesn't make any sense for any of the conditions I mentioned. And there are others. The symptoms are being blamed on concussion. I cannot count the number of people who've shown up in my coaching group who told me, oh yeah, I had a concussion and that's why I'm dizzy. And it turned out they had a concussion 10 years ago. And now their dizziness is being blamed on that. Or their dizziness showed up 6 months after they had a concussion. That again, that we're reaching for a pathology because that's how we're trained, but that's not the cause in many cases of chronic dizziness.
And that's why your work is so important. And, the work of this kind of, the field of neuroplastic pain is getting this message out there that, some sort of diagnosis is not necessarily the underlying cause, and just to talk more about the other things that are important to consider when it comes to chronic conditions, which, again, we have already mentioned this, but like I said, I think we need to kind of keep bringing it back to, for dizziness specifically, we know how much fear, obviously will play kind of a role, and maybe there's also that constant symptom monitoring of like, okay, am I dizzy? What am I feeling here? And like you mentioned, avoidance. Can you talk just even a little bit more about, I suppose, how those factors kind of can keep people stuck in symptoms?
Oh yeah. So I sort of view the fear and anxiety that come with dizziness in sort of two different categories. One of them is the involuntary category. Like you just feel scared. You just feel bad when you're dizzy. That's not because of something you're doing. It's just because it feels bad and your body's like, what is happening? I'm not oriented. But what people don't realize is what feeds that often are things that are voluntary, and they're things that we can change, which is good. I like when things are voluntary because then we can change them. So we mentioned avoidance. That's a big one. People are often told, oh my gosh, Mandy, I just interviewed someone today who had vestibular migraine, and his doctor said, it's kind of like you have a brain injury, and what you need to do is you need to stop picking at the injury. So just, you need to lay low and not do too much. This man then spent the next year housebound and afraid to walk because he was afraid that would be too much activity for him. Right. So it's not because people here are conscientious and often very health conscious. Sometimes there are miscommunications, and sometimes medical providers themselves just misunderstand that by telling people to do stuff like avoid triggers or avoid movement, or you can't overstress yourself, they're actually telling people to avoid things. So there's my little soapbox about avoiding, but that's one of them. So also, this is going to sound very familiar to people, but spending a lot of time thinking about it, spending a lot of time ruminating, what are the things that may have triggered me? How do I make sure I don't do those things, or how do I do things differently? Trying to fix things constantly, catastrophizing. Oh my gosh, this could mean getting stuck in what ifs, not knowing what to do with doubts. Because again, doubts are natural when you're scared, they're going to happen, but how you work with doubts determines what's going to happen to those doubts. Are they going to turn into a giant bonfire of doubts, or are they going to extinguish in time? And these are things that people can learn. They're voluntary.
Yeah, and I love the way that you've described that about these involuntary sort of reactions that are sort of outside our conscious control. So they're sort of not your fault. It's understandable, like we've been saying. And there's also some extra things that kind of happen alongside that we can recognize and maybe, make some choices around different things, which is, great, because that leads us into, probably what most people are here for, which is the recovery ideas and the how we actually deal with this persistent dizziness. So yeah, go for it again on your not on your soapbox, but like, what's the evidence?
You like my soapboxes? Yes,
I love it.
I love it.
What does an effective recovery look like for someone who's experiencing this, and what are the approaches that you've seen that have been most effective?
So I think everything starts with. So I know those of you here are here to figure out how to get better. Congratulations, you've already done the most important step, which is understand the most important thing, which is that these symptoms are reversible, and they are not. Again, if we have a symptom that is neuroplastic, it is a reversible symptom. It is not necessarily because you had some kind of injury or some kind of tissue damage problem. So having the education and understanding neuroplasticity and understanding that dizziness is often neuroplastic, we can't go anywhere until we have that foundation. So you've already built that foundation today. So I think the next thing is, so I describe a chronic dizziness cycle. So basically where the symptom happens, and then fear feeds the symptom, and then stress feeds into the fear, and then your own avoidance feeds into the fear, and that fear feeds back into your brain and makes your brain have more symptoms. So there are multiple points here in the cycle where we can break it. And I'm going to describe sort of the three points. So the first is how we react to symptoms themselves. And that is probably something people here are familiar with, because somatic tracking is now having its heyday in the world. But for those who aren't familiar, somatic tracking is just a way, it's a mindfulness practice, not necessarily a meditation, but where instead of trying to not have the symptom, you actually deliberately let yourself have it. You stop resisting it. You let it be there. And I know that sounds maybe purposeless, but it's not, because in the context of the education, this is why the education is foundational. In the context of the education that you already have now, you will see that when you can sit with something and not resist it, you are sending a message to your brain that that thing actually isn't as dangerous as your brain currently thinks that it is. So you're starting to correct some of that misperception that your brain has. So that's essentially response to symptoms is number one in my book in terms of how you recover. The second is those what I call fear strategies. So they're the things that we just talked about that make fear worse. Things like not knowing what to do with doubts, catastrophizing, ruminating, avoiding things, among others. But those are the big ones. Doing things differently with all of that, and we can get into what that looks like exactly. But learning how to think and respond differently to those things, that also helps break the fear cycle, because then you're not amplifying the fear as much. And then the third part is broad, but basically what's in my stress bucket. So what are the things that in the context of my life, symptoms or not symptoms, that may be causing my brain to feel sensitized? What may be causing my brain to start thinking everything's dangerous? The backdrop of your brain really matters. And I have a little anecdote that I share here that might make it clear. So I live in Florida. We don't have snow here, but I have lived in the northern United States where there is snow. So I give this example. What if you had to go to the grocery store and you wanted to buy bread and some milk, and you thought to yourself, what if I don't get there before the store closes? Well, if the context is it's a nice sunny day and you don't get there till the store closes, okay, well, that's terrible, but I'll just come back tomorrow. It's not a big deal. But if it's in the middle of a snowstorm and the electricity is going to be out for 7 days, it's the same action, it's the same what if, but the context changes everything. Everything. So you need to think about what context in your life might be causing your brain to say these symptoms, triggers, and other things in my life are truly dangerous. And that can take all sorts of different forms.
Yeah. And yeah, that's a really good analogy. And I love that because context makes such a big difference. And context can come from so many different places, our thoughts, our emotions, our what's happening at work, what's happening in our relationships. It's just so broad. It's just like what's happening within the human, basically. And yeah, also that balance of danger and safety and how can we shift it a little bit. So yeah, some really great practical sort of strategies there, which I'm sure people really appreciate. Yeah, and as a vestibular specialist, I mean, how do these kind of things that you're suggesting people approach, how do they align or integrate with what standard vestibular kind of rehab might look like? Do they?
It's soapbox time again. So look, I want to be clear that actually, I think all of us know that dizziness requires a holistic approach. So I don't want to malign anyone and say, this group of professionals is doing it wrong. I think everyone has their patient's best interests at heart and they're trying really hard, but not everyone's educated in this and not everyone knows how to put this into practice. And not everyone has the luxury of being able to talk to people for an hour like I do. So I just want to say that first, because I know there may be some of you listening who are trying very hard to put this into practice, but it's just hard in your context. So that being said, so basically typical vestibular care looks like this. Generally, they're going to send you to vestibular rehabilitation therapy, which is a specialized form of physical therapy. I'm trained in it. I'm a big fan. I love exercises. The problem is that the way that they're usually being done, first of all, is in the backdrop of an understanding that there's something wrong with you, which can sort of on its own, if the problem here is danger and your brain perceiving danger, then that's not helpful, because then you start thinking of yourself as someone who has a problem, and that self feeds fear. But also, when you have a physical problem, more is often better. Not always, but more is often better. So more urgency, more fixing, more specific focus on biomechanics, more A plus behavior. That backfires spectacularly when you have a neural circuit problem. So doing exercises 4 times a day for 30 minutes each time means that you're spending your entire day focused on your symptoms. And that is the opposite of what actually helps people. Learning to let go of the symptoms and not hyper-focus on them is actually what I'm trying to teach people to do. So vestibular therapy can be helpful, but those are the 2 main reasons I think it can misalign with the approach that I'm talking about. The other side of the coin is people are often given a checklist of all the things that they need to do to get better. And these things very often include things like keeping track of triggers, trigger diaries, keeping track of your good days and your bad days, following restrictive diets, making sure you're really focused on your lifestyle, your sleep, like you got to, manage your hormones. And I am a big fan of having a healthy body. I think people should want to have a healthy body. But what ends up happening with all of these things is they all, again, sort of backfire, because someone who's already terrified and dizzy is going to then say, I have to fix all of these things in order to get better. And then again, they start to hyper-focus and fixate on all of these things, take on these very restrictive diets, start avoiding certain foods that are almost unavoidable, like the plague. And then they accidentally get exposed to one, and then they're terrified. How am I going to... It becomes a source of fear rather than a source of safety. And safety is actually the medicine here. So we're focusing on the wrong things. Again, not to say that sleep isn't good and important. Let's get good sleep. Absolutely. But once it becomes an obsession, or once it becomes an urgent fixing thing that I need to address, otherwise I'm never going to get better. And then you can't sleep because you're anxious and you're dizzy. It is just a recipe for spiraling into further fear. And that is incredibly counterproductive.
Yeah, and I really identify with all of kind of what you're saying from a chronic pain point of view. And I think we talk about this a lot in our program, that sense of urgency, intensity, hyper fixation. Sometimes it's like a little bit part of the personality of someone who's prone to chronic pain. And that's totally something that we should just, appreciate about ourselves and acknowledge. And, how can we work with that so that we're maybe, turning some of that effort towards strategies that are likely to be more calming, more self-compassionate, more directed towards safety rather than putting all of this pressure on ourselves. So glad that you mentioned all of that as well. So coming back to this idea, I suppose, of somatic tracking, many of our community would be familiar with it. We've got lots of practices on our app and in our library about this. It obviously is one of those key neuroplastic techniques for chronic symptoms. When it comes to dizziness, is there any like little maybe hacks or practices or ways people can ease themselves into it maybe before they kind of dive straight in?
Thank you for asking that, because this is a big point of contention. Dizziness is weird and vague. So I have had chronic back pain. Chronic symptoms are part of life for almost everyone. So I'm no longer surprised when people are, oh yeah, I had a chronic symptom. But when you have pain, and not to diminish pain, because I have had chronic pain, you can locate it. So you can put your hand on and say it's here, and I can track it, and it has this quality, and it's here. Dizziness, sometimes it's just feeling off or feeling dissociated. How do you even track dissociation?
Yeah.
That's so obviously you can certainly use somatic tracking if you do have a symptom that is more, shall we say, concrete. You can certainly use somatic tracking with it, or you can somatic track the thing that feels the most concrete. But often what I have people do is bypass the symptom itself and somatic track their reaction to the symptom. Because with dizziness, again, almost always there's a very strong anxiety component. So people are feeling something in their bodies, some kind of anxiety buzz or clenching or tension. And so I'll have them track that reaction, because really, ultimately, it's part of exactly the same cycle that's keeping the symptoms going. So don't be afraid, is my advice. Don't be afraid to track something other than the symptom itself. If you have dizziness, or really any other symptom, you're welcome to track emotions if you have pain or fatigue or any other symptom. So that's one thing. The other thing is, sometimes people have symptoms with dizziness that are very situation specific. Like, okay, I'm actually okay when I'm at home, but when I drive, suddenly it hits me out of nowhere. And that can be very hard to replicate, obviously, when you're at home and trying to do somatic tracking. So a few options there. One option is to say, this is probably one of my most important messages. Somatic tracking is not playing battleship with symptoms. You're not trying to sync each symptom. You're trying to build a skill, a way of responding. And once you learn that skill, you can apply it to any symptom in any context. You should be able to apply it in real life to any symptom in any context. So, okay, maybe you don't have that particular symptom, but you have a different symptom when you're at home. Track that. Or maybe you feel anticipatory anxiety and fear just thinking about that. Great. Track that. You're building the skill regardless, even if you're not focusing on the specific symptom that you may need to react differently to. And visualization is also your friend here if you can. So you can also visualize yourself, or visualize someone else, or watch a YouTube video of someone doing the thing that you're afraid of. Often that will be enough to provoke some kind of reaction that you can then track.
And that really kind of comes back to that predictive ability of the brain, right? Like the brain can predict stuff, it can imagine stuff, and also you get the same sensations and reactions even just through imagining all that mental rehearsal. So it's so powerful, the brain, right? Like we can make it work in our favor, that predictive processing. So yeah, I love all those adaptations that people can make for somatic tracking. And it kind of comes back to just what the somatic tracking is, which is just like being mindful of the situation as it is, not trying to fix it or force it or change it. And then also that layer of safety. Oh yeah, this is uncomfortable, I don't like it, but I'm safe, I'm okay. Like this, safety messages back to your brain so that it can experience those symptoms through that lens of safety. And then just keeping it light and playful and curious, which is and also a great kind of antidote to that intensity and hypervigilance that we've talked about. So yeah, I like the idea of bringing in a bit of playfulness, which is that's a skill. There's a beautiful quote from Jon Kabat-Zinn that says that doing these practices when we are calm or when we are in situations that aren't quite as threatening can be like building the parachute before we need it. And so it's a really great skill to kind of continually build in lots of different circumstances. So I can see that we're kind of getting close to time here. It's been like, I'm sure you could, and I could definitely listen to this for ages. But, for the person that's listening, either here live or maybe afterwards at home, What would you like someone who's been struggling with this symptom, for a long time, it's become chronic, it's weeks, months, years even, what would you like them to know?
Okay, two things. First of all, most dizziness that's chronic is neuroplastic. It's something that can be addressed using the tools that we're talking about today. So whether you have a diagnosis or not, most of these diagnoses that describe chronic symptoms are simply different names for you have a neural circuit problem, something that is being caused by this predictive processing issue in your brain, which means it can be addressed using these methods. Second thing, dizziness is a bit unique. And some people who have found this app, some people who have found other people in this space who work with chronic pain may find that some of the techniques don't work well for them. And they may wonder, maybe dizziness is different. So I started by saying dizziness is the same, and now I'm saying dizziness is different, but I'm bringing it back to dizziness is the same. So first of all, that doesn't mean it's not neuroplastic. It doesn't mean it's that you can't get better. That's not what that means. It means that dizziness can be a little sticky because of the fear it produces. So the best advice I have for people listening is if you have dizziness and you're like, yeah, that is my sticky sensation. That's the one that won't go away. And I was wondering if it just meant I couldn't. No, it doesn't mean you can't. It means almost certainly that you have a lot of just kind of natural fear and anxiety being built up by the symptoms themselves. And many of the techniques out in the world that are used for people with anxiety issues are going to be really helpful for you. Not because your problem's anxiety. I want to scream that from the hills. I want everyone to understand dizziness is not anxiety, but the anxiety is often what keeps dizziness so sticky. So using those techniques can be really helpful.
Yeah, thank you. That's such a great message of hope, I think, for people, that these things they are changeable, and, finding your own way, which is what we kind of encourage everyone to do, is like do the little tweaks and find the way that it's going to make it work for you. Just check quickly whether we have any questions. It doesn't look like it at this stage. You're always welcome to email them through to us afterwards. We can sort of follow anything up. But before we finish, is there anything, Dr. Yo, that you wanted to say that you haven't had a chance to yet, or anything else you want to sort of leave people with?
So I think that this is going to get a little philosophical, but you mentioned this earlier. I just think it's worth repeating. The work that you're doing here, the more you can see it as something that you're doing for growth and furthering your quality of life in general, the less it has to do with fixing symptoms, the more effective it's going to be at fixing symptoms, and the more effective it's going to be in general at improving your life. So I know there's maybe some component of, yeah, Yonit, but really I'm here to get rid of symptoms. And I get that, right? I get that. You don't have to lie to yourself. Let that be there, but then see if you can focus your attention on what this can do for you in life beyond helping you with symptoms, because where your focus goes, your brain knows. So your brain knows what you're focusing on. And even if there's a little bit of that, I'm trying to fix symptoms, the focus is going to help your nervous system understand the symptoms and triggers are not dangerous when you're not focusing on them that way.
Yeah, beautiful. I think that's such a great place to finish the discussion and give people that opportunity to work towards where they want to go, definitely. Thank you so much for your time today, and definitely for all the work that you're doing in this space in terms of getting these really important messages out there around this symptom, and that the neuroplastic component to it, and the fact that it's something that we can change. I'll link to your YouTube channel, The Steady Coach, below. So yeah, anyone else, if you're experiencing this symptom or other chronic pain symptoms, obviously there's support within our program. Please go and check out all the different resources. In a couple of weeks, we'll be having another More Good Chats live, focusing around sleep and the evidence-based approaches that are helpful for that. Again, thank you so much, Dr. Yo, for being here today. Thanks to everyone that's joined live. And yeah, we look forward to seeing you all soon. Thanks, everyone.
Thank you.
Thank you.